very careful with putting a lot of consequences on a single assessment. If we look at studies where we look at reliability of different methods of assessment, and we've done that in the past, and here's a table of different methods of assessment, which shows that reliability as a function of testing time in order to make them comparable across different methods of assessment. And they say that you need at least a reliability of 0.80 for tests with consequences. And even so, with a reliability of 0.80, you must be aware that you still make probably some 20% false positive and false negative decisions. And if you look at this table, it's quite somber. It's not a very positive table. It means that you require quite some testing time in order to come up with a reliable outcome. So be very, very careful with very high stake decisions based on any single measure. Most of our tests in actual practice are not that reliable. This is bad information. This is bad news. Although at the same time, this table also has good news, because you cannot say that very objective examinations like the multiple choice is more reliable than most subjective judgments like the long case or the oral exam.
Okay, guys.
This means that many subjective judgments can be pretty reliable, which is important, which I'll come back to. So subjective judgments can be reliable provided that we gather sufficient data. The second thing that I'm always worried about is the side effects of assessment on learning. And if we look at the literature on the impact of how assessment drives learning, then we also see quite a lot of negative impact. I mean, we see a lot of poor learning styles. We see students hunting for grades. But the most thing that we see is a lot of reductionism. There's very little feedback in the system. Yeah, we give students a grade, but you must realize that grades are the poorest form of feedback one can get, particularly with complex skills. Feedback is not really well expressed in grades. And also what we see is a few longitudinal elements. Most of our assessment, if I would put it in a caricature, this would be the caricature. This is what most of our assessment is like, right? So a piece of education, students learn for it, and then they forget it. And there's a lot of evidence in the literature that only learning for the occasion has little effect. And then thirdly, the thing that I'm mindful about is that our education is changing from a very knowledge-oriented program to more competency-based programs. And if we look at the competencies around the world, and here are 3 competency frameworks, then what strikes me is that most of the competencies that are mentioned are non-knowledge oriented. They're very behavioral. They're complex skills. Try and define communication skills or professionalism. Try and to capture that into a single checklist. Very, very difficult. Yet we all have an idea. If we look at professionalism and we see problems, we have an idea of what professionalism is. I think that given this competency-based movement, we need to assess much more in the top of Miller's pyramid, much more in looking at behavior, much more unstandardized assessment. And we are pretty well in doing standardized assessment by multiple choice tests, by OSCEs, by making every single assessment as objective as possible. But in unstandardized assessment, we need to be much more subjective. We need to be assessing in the authentic situation, whether the authentic situation is in the school, in the learning situation, or whether the authentic information is in the workplace. So we need to assess a lot more there. And there's a lot of methods and technology in unstandardized assessment that is emerging. Direct observation, multi-source feedback, field notes, all those kind of instruments are quite interesting and are developing. The implication for assessment, I think, is that instead of the more classical approach, which is about training for a test and then forgetting, I think that the more modern approach to assessment is that it should drive deep learning. And I think that if we talk about these competency-based curricula with a lot of emphasis on complex skills, assessment should be feedback-oriented. You can only learn good communication by doing it in actual practice. And then getting feedback on it. So assessment should be feedback-oriented. And we've learned that particularly around more complex skills, quantitative feedback has its limitations. And we need a lot of qualitative feedback. We need more words in assessment. They have a lot more impact than quantitative information. And the assessment should not only be modular, but should be ongoing, should be a continuous activity, looking at development of growth of competence over time. By doing so, we move from a system which is primarily based on modular Big Bang examinations to a system of more feedback with an ongoing continuous system of assessment. As a result of that, I have developed a model which I call programmatic assessment, in which the assessment is done at a very different way. In programmatic assessment, every individual assessment is but one data point. And there's a delta behind this data point because that's Miller's pyramid, because it can be any method, doesn't really matter. The kind of method is dependent on your educational justification for using that method at a certain point in time. And I'm kind of agnostic in relation to method of assessment. I don't care. As long as you have a lot of variation, you allow your learners to write over here, to verbalize over there, to defend over there, and so on and so forth, making it educationally meaningful. Any individual assessment in programmatic assessment is not meant for decision-making. So we take away the pass-fail decision from the individual moment of assessment, from the individual data point. Each individual data point is meant for feedback, not for decision-making. And we replace the discussion around summative or formative with the continuum of stakes. So if you have a single data point, a single measurement, there's not much at stake. There's no pass-fail decision. It has a small stake. But if you take a high-stake decision, for example, promotion to the next year, you need a lot of data points. And here's a summary of the stakes. There's a continuum of stakes. If there's a single data point, a single assessment is focused on feedback. It's purely feedback oriented, meaningful to learning. It's not decision oriented, no pass-fail decisions. And then maybe halfway through the year, you have to take a progress decision. How are you doing? What are your strong points? What do you need to develop further? And then you need more data points, and you need to make a diagnosis. You need to give feedback on where you stand. And then ultimately, there needs to be a final decision. You need to pass or fail, perhaps at the end of the year, decide whether the learner has to promote to the next year or not. That needs to be done on a lot of information. And if you have a lot of information, if you have quite a few data points, you have information that you can use for decision making. That decision, by the way, should not be surprising, because along the way you have given information on where you stand, and it should not be a surprise to you as a learner. Basically, what we do is we use pixels. This is the metaphor. So an individual data point is a pixel in a photograph. And with an individual photograph, you can't see a lot, an individual picture. But if we add pixels to the photograph, you slowly start to see the image. And once your image is clear, then you can take a decision. So this is the basis of programmatic assessment, which is now being applied back in Maastricht, but also in a lot of other schools, both at the undergraduate level as well as the postgraduate level, because the application of programmatic assessment is generic, is not limited to either undergraduate or postgraduate training. Actually, a lot of postgraduate training uses programmatic assessment in the world. To give you an example, as a final part of my presentation, we use it in Maastricht in our programs. And to give you an example, we have assessment in modules, we have assignments, presentations, we have block assignments, but we also have a lot of longitudinal assignments and a longitudinal assessment. For example, we have progress testing, where we give a written exam 4 times a year as a final exam to all our students. So all our students sit a written test 4 times a year. They can't prepare for it. They just have to do it, and they're getting information on that. And I'll show you some of the feedback later on. But we also do a lot of peer assessment longitudinally. So how do you develop your professional behavior longitudinally? And all the assessment is informative and low stake. So you don't pass or fail on individual assessments. And the portfolio is the central instrument. You gather everything in an electronic portfolio that ultimately is being judged, but also is being guided. So here's an overview. You have several modules, you have 4 progress tests a year, and you have longitudinal module exceeding assessments of knowledge, skills, and professional behavior. And every student is connected to what we call a counselor, which I don't like as a term, but let's call that person a coach. So the coach guides the student along the way. The coach has access to the electronic portfolio and has regular discussions with the learner about his development. And at the end of the year, there's a decision made by a committee, not by the coach, by a committee, on passing or failing based on all the information in the portfolio. We spend a lot of time and effort on feedback. Give an example. This is one example of a student can log into a system and look at his progress test scores over time. So he can look at his knowledge over time and then see how it relates to the rest of the cohort. And he can do, or she can do this for his total score, but also for basic sciences score, also for individual anatomy scores. You can look at your scores over time in any area of knowledge and see how well you do in relation to the rest of the cohort. We also have a lot of work-based assessments. So here's an example of the feedback from the electronic portfolio on a set of competencies. We use the CanMatch framework, and the portfolio generates all the feedback for these competencies for you as an individual and related to the total as a cohort. We can also monitor everything in time. We can click on any button, and each button will reveal your individual assessment, your individual scores, and your individual narrative feedback. We also have a very important function in the electronic portfolio, which says, generate me all the narrative feedback on this particular student. And then you get all the narrative information on this particular learner. And you can filter this by competency. You can get a very quick overview of the performance of an individual learner. Ultimately, the assessment is done, the coaching is done by counselors. We call them counselors. I hate that term. I rather call them coaches or mentors. And it's very essential for learning. What we have learned is Maastricht is very much about problem-based learning, self-directed learning. But what we have learned is that self-directed learning requires a lot of directing. And we have learned that feedback and the use of feedback is not an automatic thing. And scaffolding the use of feedback by, for example, a mentoring system is really, really important. So that is done by our mentors. And they have a strong relationship with their students. So they have a personal relationship with their students, and they meet them regularly. Finally, the decision-making is done by a committee of counselors and externals. They reach a consensus about an individual learner, and they deliberate. If they, you think this is a lot of time, in reality, it's not, because for 95% of the students, this is a no-brain decision. And the committee only takes a lot of time on the very few students that need deliberation. And then they come to a consensus and they can justify the decision. And therefore, I think it's a valid decision making. If you're interested in programmatic assessment, then please visit my homepage. A lot of publications have emerged in due time, and you can learn more about it. To finish up, I was supposed to talk about the trends in assessment. Well, here they are. I can't go through all of them, but there is a traditional summative assessment approach in which we are often captured. And an alternative approach is possible, which is less pass-fail oriented, which is more feedback oriented, where we don't talk about grades, but we talk about information-rich information, which is less modular, but more longitudinal, where we don't have resits, but we have personal ongoing remediation activities, where we don't use big bang objective exams, but we use an eclectic approach to assessment and different methods, and we focus on information. And we aggregate all that information and we triangulate that information to a whole. And we structure and we use a mentoring system to support the learning of the student and the self-directed learning of the student, and where we use a lot more professional judgment. Now, is this more corona-proof? I think so. With less reliance on big external exams, you have a lot more continuous data. To give you an example, naturally, we are now limited in Maastricht to not take big exams face-to-face. So our progress test has been cancelled. But nevertheless, we do have past performance of all the students on the progress test and on all other elements of our assessment system. So we do have a lot of progress information from our students that we now use to make decisions, and where we now take decisions in terms of how many of those students do we not need to regard any further.
Hello. I think we have to re-admit. Okay. There is an internet connections trouble with Professor Cees, I think. Dr. Nadia. Yeah.
We are still trying to contact with Prof. Cees. Shall we continue meanwhile?
We can continue with, like we wait for 1 minute, but we can continue with my slides, I think, after that. Okay, Dr. Nadia, could you share my slides? I think this is the last slide of Professor Cees van der Vleuten, so we can move to the other speakers. Dr. Nadia? Baik, Bapak Ibu sekalian, sambil kita menunggu readmission dari Profesor Cees, yang tadi itu sudah merupakan slide terakhir dari beliau. Jadi ini kita lanjutkan ke pembicara berikutnya, yaitu saya sendiri. Saya hanya akan meng-echo atau melanjutkan apa yang sudah dipresentasikan oleh Profesor Cees. I think since he's not here yet, so I will try to speak in Bahasa Indonesia. Is that okay?
I'm back again.
Okay, sorry.
Please go ahead. Please go ahead. Please go ahead.
Okay, sorry. Yeah. So I explained to the participants that it was your last slide, so we can move to. Yeah. All right. So I just want to echo what Professor Cees has already speak about the importance of continuous assessment and how we gather the data from various methods of assessment, from various source, and then the feedback is very important. The key of the assessment itself to help the students' growth to be better. So. But for Indonesian settings, in the Indonesian culture,
jadi CSR atau case fatality rate-nya adalah
yeah. So, okay. Yeah, I will continue. So for Indonesian settings, we have a specific culture, which is very much different with Western culture. Next slide, please. So there is a theory of cultural dimensions by Professor Geert Hofstede. He wrote many books and articles. He studied about how people from different cultures and countries, they can do business, but they have come from a different culture. And then Professor Geert Hofstede grouped those countries into the 6 cultural dimensions that he found. Next slide, please. So this is his study. He grouped about 50 countries in the world, and there is you can see that in the right side above is the countries with large power distance but low individualism in decision making. So we are very collective, and we can see that there are countries like Malaysia, Philippines, like Hong Kong, Singapore, Korea, Thailand, Japan, and it's like sort of representative of the ASEAN Southeast Asian countries like Indonesia. Whereas the countries that lies in the Western countries, it's below on the left side, in the low curve, the countries with small power distance or they have a more partnership relationship with the people, and but they have high individualism in terms of decision making. Next slide, please. So this is the, if we click on the slides of Professor Hofstede in the website, we can see the differences. Like if we put like 3 different countries, Indonesia, Netherlands, and United States. For the power distance, we can see that Indonesia is high, like 78 score among 100 scores. And for Netherlands and United States, they are medium or a little bit lower. So they are more partnership. But then when it comes to the decision making, Indonesia is very low, like 14. So we cannot like decide by ourselves, but we have to ask our relatives, family, and the community. And it's very different with the people from the Netherlands and United States that they depend on individual decision making. The next slide, please. And this is another illustrations. We can see the green one is the power distance world map, and Indonesia is very green, very hierarchical. It means that the social distance between people are wide, and people accept that. So people accept the social status, but then when it comes to everyday dialogue, there will be minimum dialogue, two-way dialogue, because it will only be like one-way style. And the right side is the collectivism versus individualism. We can see that Indonesia is a little bit like pink, so it's not very individualistic compared to like US or Australia. So when it comes to the decision making, Indonesia very much depend on like community decisions or communal decision instead of individual decision. Next slide, please. Yeah, this is another illustrations of the power distance and the collectivistic culture. And among the 6 dimensions of Professor Geert Hofstede, I only discuss these 2 dimensions because it will influence our relationships in daily relationship between the doctor and the patient, between the teacher and the students, and also between, like, for example, the parents and their children. Next slide. So implication for teaching and learning in Indonesia, we have so many local, which is published internationally, evidence that prove the social distance and the collectivism decision making. There are a lot of research like this, like in the doctor-patient communications, that is exactly one-way style. There is no dialogue between the doctor. If there is a dialogue, it's very minimum. And this kind of research is already been done in different kind of health professionals, not only the doctors, but also nurses and pharmacists, and also midwives. And like the other paper by Dr. Yoyo Suhoyo about clinical workplace learning, perceiving feedback in the collectivistic culture. And also the feedback in the non-shifting context of midwifery education, they all prove that there is a hierarchy and there is collectivism in decision making. So it is indeed very hard for us to start the feedback culture, the dialogue in which is the heart of the programmatic assessment. However, next slide. Yeah. However, when it comes to the summative assessment, as Professor Cees has already told us, that there is no reflection. if we do like summative assessment at the end, please don't ask for any reflections or awareness from the participants or from the institution, because everybody will forget. And there is this is only one dissertation, but I believe that there are so many evidence proof in this, like Professor Cees already explained. The students who pass, they will forget because they're very happy, but they will forget. And the students who fail, they are very sad and angry, but they also forget. So nothing to do with the reflections. If we want the institution to reflect, oh, you are not so good in quality, or I'm not so good in learning, please do not use the summative assessment, because there is a very small implications for reflections. Next slide, please. Yeah, practically, so what does it mean for us in medical education? As we know that President Joko Widodo already said that there is no national exam for elementary school, for senior and junior high school. So my daughter, which is the 6th grade of elementary school, said to me that, "Mommy, I don't have any exam anymore." And so I asked her, so how you will pass the 6th grade and then you will go to the junior high school? And then she said that my teachers will collect all of my past performance, just like what Professor Cees have said. And then it will become my marks. And then I'm so happy. And she said that, and then I think I'm so happy too, because this is exactly the what we need for Indonesia, assessment for learning, not assessment of learning, that it is part of everyday teaching practices. It's part of everyday collecting evidence from every individual students. It used to inform and adapt the teaching practice to inform the students where is your strength and where is your weakness and how to improve. And it's done in conjunction with the students to engage them in their own learning. And it's a quick way to gather information about students' learning. So just easy. My message is that we already have the national exam like UKMPPD or UKDI, but I think it's a time for us, although it is very hard, and because considering our healthcare system and our limitations in the number of medical doctors and number of consultants and number of students, but I think we have to start to use feedback and continuous assessment to balance the national exam. Next slide, please. yeah, this is another illustrations, how we focus on the pupil, how to recognize educational achievement, how to promote understanding of goals, and is the key of professional skills, like Professor Cees already explained about the competency-based curriculum that we want to achieve require a lot of DAS in a Miller pyramid, a lot of DAS behavior like professionalism and communication skills, and it cannot be just like one single exam at the end. It has to be continuous and growth and develop throughout the process of learning of the students. Next slide. Yeah, so this is the 5 keys of strategies assessment for learning, like sharing learning expectations, the dialogue between the students and the teacher, the evidence from daily practice, how to give feedback, how the students reflect on their performance and how to make it better, how the students do self-assessment like portfolio that Professor Cees already told us, and also peer assessment is very important. Next slide, please. Yeah, I think that's my message. So next, I will try to invite Dr. Fundi to explain about how to adapt the competency-based assessment in undergraduate medical education. Please, Dr. Fundi.
Thank you, Dr. Mora.
Yeah.
Yeah. Thank you for this very nice occasion, especially for the committee who has invited me. Actually, there is an unpleasant feeling for me as a resource person because there is a brainstorm for myself related to this condition. So why I entitle my presentation like this, because in this situation, as Professor Cees said, that everybody in the world right now would like to find any suitable assessment process in their schools, I think. And I also would like to echoing Prof. Cees' message for several things about the assessment system. So I think this picture reminds us that this is a painful repetition that all over the world face the bad condition that we have to cope. But I would like to share my other opinion that is it a disaster or opportunity? Because this time I think we are now preparing the grand teacher of the next medical professional who will battle the other repetition in the next time. Then they still need to learn in this condition and hope that there is less gap in the next time, because I'm so afraid that if the assessment system is bad right now, so we will graduate many medical doctors and other health professionals. So there will be many incompetent graduates in the future. So we need to learn how to assess. We found that there are several problems in assessment. Professor Cees said that we are more focusing about the knowledge, but also we need to assess the affective and psychomotor domains. And from the literature, it is very difficult to assess the affective and psychomotor domain during this time. So, and we also face the problem of shifting from the traditional assessment to the programmatic one. I think it is very nice to have a good picture of Mona Lisa than only a blue one. And I think many medical schools right now has bad preparedness for the assessment system of their students, and the society still needs competent graduates. So what is our response at this time? I think all the teachable events right now are conducted in the online session, as Prof Cees also answered one question from Dr. Titi that in Maastricht, every face-to-face session are gone. So every school, I think, have some learning platform and also online examination well in their for their students, and also students need to access it. But yes, we can understand that they have to pay money for the access itself. So we need to find a good chance for students to enter into the platform. So it is the difficult part, that we have to design the assessment system from the start. I'm not sure that all programmatic assessment is conducted in every unit or every time unit, but as Dr. Mora said, that assessment now is not only of learning but also for learning. But the other paradigm is the assessment itself is the learning itself. I use Professor K's utility of assessment concept, that every assessment that we use in our educational program should consider the reliability, validity, educational impact, acceptability, and cost. So this is the big question. What is the most common exam tool in our schools? Yeah, perhaps I will say in my schools, we use MCQ very big portion for this. We can also say that we also use essay, we use also oral exam, projects, and others, but it is very little part of our assessment. And the next question is, are they work well for the purpose? It's very difficult to say, but I found some severe problem if we use only MCQ, but it is now in the middle of the pandemic. We cannot just stop the pandemic, and we design the new system, and the system need to be restart. So in this middle of the battle, so the next question is, does the online exam respond, it is reflecting the student achievement? I'm not sure to say yes. So we need to design the rule of pre-exam, during the exam, and the post the exam. That sometimes it needs some decision to retake the revise the result, or maybe others. And I think to control this, we have used the item properties to control our exam, but we also have the other tools that we can find some protocols or methods to detect some kinds of cheating in the exam. So I think we can, in this situation, we can use this method to provide a better exam for our students. And finally, of course, we have to redesign whole system to the more programmatic assessment, as balance of the what Professor Cees said, Big Bang final exam. So I think, yeah, this is our task to think together to find how the assessment system will conduct it better. And thank you for your attention. Thank you, Dr. Mora. I'm finished.
To invite, hello, sorry.
Hello, yeah.
Yeah, so thank you, Dr. Fundi. We will discuss your concern later during the discussion session.
Okay,
And
thank you.
yeah, I would like to invite Dr. Diantha Soemantri to present about the competency-based assessment adaptation in the clinical education and residential training. Please welcome Dr. Diantha.
Thank you, Dr. Mora. Good afternoon, ladies and gentlemen.
Good afternoon.
Yes, so I'm the last presenter of this webinar, and I hope you can bear with me for around 10 minutes. I'm assigned to discuss about the adaptation of the assessment system in the midst of a pandemic, especially in the clinical clerkship phase and also residency program. My disclaimer is that my presentation will perhaps be dominated by more questions than answers. So we can discuss most of the answers, hopefully, in the discussion session afterwards. So in the pandemic situation, what we see now, and perhaps most of you have also experienced it, is that we replace existing educational approaches with online activities, usually for knowledge and some of simple skills. Us in Universitas Indonesia have conducted online clinical skills teaching, but only for simple skills that they can conduct in their own home. No sophisticated equipment involved, and then they can share the video of the students doing the clinical skills, and then they can send it to the tutors, and the tutors can then provide feedback upon their students' performance. So the switch to the online activities also includes to the assessment, as Dr. Fundi has mentioned in the previous presentation. Most universities, including ours, Universitas Indonesia, has also switched some of our assessment to the online assessment using our online platform. And I guess this is reiterating what Dr. Fundi has mentioned also, that the challenge of switching our assessment into online assessment is the possibility of we assessing the wrong construct. In assessment using technology, the technology itself may introduce a new problem that we don't assess what we expect to assess, but we assess different things, like their proficiency in using technology. Vice versa, another problem can also occur when students cannot pass the exam, not because he or she does not master the content, but because he or she has problems with technology. For example, poor internet connection, incompatible devices, etc. And so I guess this is a very relevant situation here in our country, where the internet penetration rate in regions of Indonesia is still varied. In some parts of Indonesia is still quite low. Although we expect medical students have access to internet because they need to have access to internet to access resources and so forth. But looking at the data on the internet connection speeds in Indonesia, it's quite low compared to other countries, and it's even below the worldwide average. Why do I put this slide is because when we do the assessment, the online assessment, there are other factors that we need to think, not only their mastery or their mastery or their ability to master a content, but also the technological aspects. We perhaps in several medical schools, there could be students who have poor internet access or older devices where they have trouble in accessing the online assessment and they fail the assessment, not because they don't master the content, but because of the technological problem. So perhaps in this situation, we need to be more flexible, fairer, I think, in terms of the consideration of many different students and different access to technology. So when a student cannot complete, for example, the online MCQ assessment in the online platform, perhaps then we could arrange for a new assessment or a different format of assessment. That kind of flexibility, I think, is very, very important nowadays. So we don't jeopardize our students into failing them, not because they worth failing, but because of other factors. So I guess the problem in the clinical clerkship and the residency program is not as simple as that, because as Poe and Sanders argued in their latest paper about adaptation of educational system in the era of the COVID-19 pandemic, a major challenge for medical educators at the present time has been to replicate the experience of clinical encounters. We all agree that in the clinical clerkship and the residency program, clinical encounters, clinical experience, interacting with patients, with fellows physicians are very, very important, very and paramount in this situation. So because of the low, this is my suspicion, because of the low number of physicians and healthcare workers in Indonesia, when in our country, the scale of the spread is keep increasing, and some people said we haven't met the peak of the infection yet. Perhaps in the near future, the focus of all healthcare workers and also students of healthcare professions, especially those in the clinical phase, may be shifted to the efforts of combating the disease. And we have known now that medical students, some of our medical students in the clerkship phase are asked to become volunteers, of course, with tasks appropriate for the level of capacity. And also the situation is that many teaching hospitals are now become the referral hospitals for COVID-19. And this is just my list of what I can think of is happening around us now. Of course, you can also add to the list. And with the high number of teaching hospitals becoming the referral hospitals, we see that everyone in that referral hospitals are focusing on helping the patients, on managing this pandemic. So I assume that there will be limited number of teacher physicians who can actively teach, because most of them are in the front line. They actively work to provide clinical service, and their alternate as a working schedule. So in that alternate working schedule, and also because of the residents are also part of a healthcare team, and some even are frontliners, and they also have alternate working schedule in their hospitals. So I gather that proper teaching and supervising at this moment can be very, very, very limited. And we also have to consider the physical and psychological safety of everyone involved, our colleagues, our physician teachers, our students, our residents, in this very moment of, this is, I think, our president has established this as a national disaster, and in this national disaster, everyone's physical and psychological safety could be compromised. And of course, it is even more relevant for the healthcare workers who are dealing with patients every day. This could also be extra burden. Okay, so in a conventional setting, we can think of, when we want to design assessment, we think of what are we going to assess? Why are we going to assess? Is it formative? Is it summative? When and where are we going to assess, and who will be involved in that assessment, and also how to assess, how to set the standard and everything. But in the, But in the midst of a pandemic, I think there are other questions that we need to ask, the additional questions that we need to ask. The first is, do we need to assess now? I think this is very important, because I personally think that we don't need to do anything now. I think we have priorities now, and perhaps there are things that we can postpone. So I think the first thing is that to answer the questions whether we need to assess now. As Professor Cees and the previous resource person have mentioned, is that whether we can use existing data points on student performance to make a decision. So whether we have data and whether we have enough data to decide on students' performance. And this will help us to think of whether we need to assess now or we can postpone the assessment, or do we need to assess at all? And of course, the stake of the assessment is also very important. If we assess the final year students, it is a high stake assessment where we need to really carefully consider the consequences, both short and long term. Of course, consequences to the health, the community that are going to serve also. But if we assess not a final year medical students, perhaps we can think of postponing it perhaps because they still have time. And of course, it also depends on how much data we have on every student's performance. And I think this is also important. What kind of support can we provide both for students and residents and also the faculty? If we we still insist on doing an OSCE, for example, can we ensure the safety of everyone involved? Can we ensure the safety of our teachers who are going to be there? Can we ensure the safety of our students who have to attend the OSCE, for example? And also the support of an online platform, the support of the psychological support for everyone involved. I think it's also quite important in this era. So all in all, I think we need to rethink our assessment blueprint, as Dr. Fundi has also mentioned previously. And after we rethink it, we reshape it, what kind of assessment blueprint that we are going to have now. And I find this whole brain perspective is quite helpful for us, for starting asking questions of what do we know? So what do we know about our students? How confident are we about their performance? And then after that, we try to explore what do we need to know? What else do we need to know from our students about their performance, about their knowledge, about their professionalism, about their attitude, and so forth. And afterwards, we can think of what might we need to do. So after we know what we know and we know what we need to know, we think of what we might need to do to obtain more data, perhaps, to ensure our confidence, our own confidence to pass or fail a student. And then we think of how might people feel. I think this is very important in the era of pandemic, where everyone is perhaps struggling to stay alive, to stay well. We have to think about other people feeling and also their family, and what are the consequences that will occur to everyone involved, the teachers, the students, the health, the school administrators, and so forth. And after we consider every consequences that might happen to everyone involved, we then decide what we should or could do in terms of our assessment. What kind of assessment blueprint that is feasible, that is still relevant to provide us with data that we need, and the stake of the assessment is also one consideration. So I guess we've learned some things within the pandemic that is currently ongoing, and I think there are also lessons learned that we can have after the pandemic is over. And I think the very important pandemic is very important lessons learned in this moment is not to rely on one method of assessment. I think the other speakers have also mentioned about this, that we need to have a programmatic assessment where we have multiple data points originated from multiple cases, multiple contexts, multiple examiners, and these are providing adequate data for us to make a decision about the performance of our students and residents. And I think portfolio is becoming more and more important, because portfolio contains the evidence of learning and progress of our students. And these could include everything that they have learned, everything that they have improved, every progress from poor performance to good performance to excellent performance we could see in this portfolio. And then we can be more confident and then make an informed decision about our students or residents' performance. And I guess this is also important. I personally think that We are more confident and more feel more safe if we pass students that we know are self-regulated learners. We know if we know them as a lifelong learners or a very good learners, have a good learning styles, have a good self-regulation of learning. So I guess portfolio also be helpful to become a tool to nurture students' self-regulated learning, because from there we can see how they have reflect on their performance, how they have self-assessed themselves, how can they seek feedback, how can they properly respond to feedback, how can they formulate the action plan, the learning plan, and how can they reflect on that as a learning cycle. So portfolio not only useful for keeping all the evidence of learning and students' progress, but it also a very useful tool to nurture students' self-regulated learning. And when we have this, I think we can be more confident, and not only confident, I think confident might not be a very good term to be used, but we have all the data. We make an informed decision based on the data that we have. Thank you very much for your attention and stay well.
Dr. Diantha, I think you've made a very good summary of our overall presentation at the end. So now we begin to discuss. Dr. Titin already informed me. So the first questions is it's about the distance learning program in Maastricht. Professor Cees, I think you can explain there are a lot of distance learning program and like a medical education's master program and PhD program. So would you like to explain about that? Hello, Professor Cees.
And yeah, yes, thank you, Mora.
Yeah.
Yeah, our master's program in health professions education is nearly completely distance-based.
Yeah.
And it is based on making assignments, which means that you have to study some literature and then apply it to a particular situation, on which you have to write a paper, which you submit to your teachers and you get feedback on it. And that is the essence of the distance learning part. You are also assessed on these essays that you hand in. We've been doing this for many, many, many years now, and it's working really nicely. We also often have peer-related activities, so that if you do a particular assignment, you work with a peer and you ask the peer first for feedback, and then you submit your work to the teachers. So there's a lot of peer learning as well. This is for the master's program. At the moment, during the pandemic, our normal training programs, like in medicine, we are all online at the moment. So everything is done via electronic platforms. So PBL groups are run through electronic platforms at this moment.
Okay. And then what about the undergraduate medical educations, distance learning during this pandemic situation?
Well, that's via the PBL, via the tutorial groups, which they do online at the moment. It's completely online. And what we've done in relation to assessment is that we have used the past information to determine whether students are okay. If they're okay, then we don't do anything. Then they're okay. If they're not okay, we organize an individual solution. So we have an individual assessment, maybe a progress test or maybe something else. But this is limited to, let's say, a handful of students, right? Because the rest is okay.
Okay. Then the next question is from Ibu Meilania. how many pixels or data will be enough to measure one's competence?
I can't answer that in a number, because that depends on the kind of saturation you find in the information. Typically what you do is you have a lot of pixels, you look at the consistency, you look at the triangulation of the information. And if you see certain patterns, then you're pretty sure that you have sufficient data points. By the way, we've just written a review on programmatic assessment, and the review is quite clear on the fact that you have sufficient data points to make a decision. That's not the issue in programmatic assessment. The issue is not about having sufficient data points. The issue is much more about the quality of the individual data points, about the information value of the individual data points. If you have a lot of unvaluable, non-meaningful data points, you can do a lot, you know. So it's much more about getting the feedback right, which is a difficult issue because, you know, feedback takes time, takes skills of your teachers. So that's not an easy thing to do. And feedback, particularly if we talk about complex skills, and there was one of the questions on the chat box. Can you give an example of feedback? Feedback is mostly about engaging in a discussion with your learner and asking questions to start up a reflective dialogue. So if you have observed a learner seeing a patient, then you sit down and you ask questions, right? You ask questions like, what were you thinking about? Why were you thinking about that? What else could you have been thinking about? Did you note the response of the patient when you said this? How could you do that differently in next time, right? So feedback sounds like a one-directional approach, but it isn't. It is a dialogue with your learner.
Yeah, and it's very difficult in our culture to start the dialogue.
Yes. Yes. I often do training programs with clinicians about how to give feedback. And actually, I'm pointing them to the fact that the kind of skills, kind of questions that they use, the kind of skills they use is very similar to doctor-patient communication.
Yes, exactly.
Asking open-ended questions.
Yeah.
Checking if the information has been understood. Asking about certain feelings. Summarizing, you know, but you know, these kind of skills are not always used globally, as you know, Mora. You have done your own dissertation on it, but they're very similar to your doctor-patient skills.
Yeah. So the next question is how a mentor should handle how many students?
About 10 students in our case.
About 10
but that's all. That's an issue of money. That's an issue of resources. Right.
Okay. Logistic. And the next question is, so how qualifies the national exam? Like, perhaps Dr. Pundi or Diantha could also comment.
I guess, well, about the national exam, this perhaps not the focus of our webinar today, but I think hearing what Prof. Cees has mentioned about the programmatic assessment, the importance of qualitative assessment, the feedback, and all in all, I think we need to ensure that the medical schools is able to do it. I'm doing now a project of developing e-portfolio in our setting, and we found it to be quite challenging to have teachers to provide time to look at what the students have reflected on, and they need to have time to give feedback. And I guess because what's important now in the school is the summative assessment, the MCQ assessment in every blocks or every module or every module, then they don't see this portfolio as something important. They don't see this feedback is important, because their focus, as Professor Cees has mentioned, is that they focusing on the summative, the MCQ exams. So I guess it starts from us as teachers to send message to the students on what is important. If feedback is considered important, then give it to them, a reflective feedback, so that they can see how feedback is working for their progress. And we perhaps less, I think it's all start from us. I mean, whether the schools are brave enough to have more data points, more formative assessment, for example, not relying too much on the end semester or the end block, the end module assessment. So once I think we are good enough in our programmatic assessment, the data is generated, in a proper way, enough number of supervisors who give feedback and who give assessment, then I don't think we need exit exam. But I guess the problem is now whether the schools are ready to implement the programmatic assessment. That's my personal thought. Thank you.
It will take a long time. It will take a long time because, people need to understand why they have to change. And the focus nowadays still is a lot on knowledge, therefore multiple choices, therefore on national exams. And national exams can only focus on standardized knowledge, maybe OSCE assessment, but that's it. I've been in contact with certification organizations around the world, reflecting on the fact that competency-based medical education requires a lot more than the things that they can assess in a standardized way.
Yeah.
And I think that's the value of competency-based medical education, that we need to address other kind of skills. And that's going to be a long battle with our teachers before they get to understand that. But also, just had a discussion this week with one of our clinicians who says, Cees, should we not change our progress test to an open book exam? Because basically, what's the relevance of knowledge? Knowledge is in my phone if I need it. And that's what I do. Why do we need to impose so much knowledge on medical students? And but knowledge is volatile nowadays. It's in my phone. So that's a very interesting discussion. But I think that it requires a lot of time before we move away from our traditional approach of modules, handing over information, testing the students, move on. And this traditional model, has its limitations, but it will take quite some time to come over that. We need a lot more staff development. That's also the issue that we found in the review on programmatic assessment. It's all about involving your stakeholders. Can you convince your stakeholders to move along, to understand why they have to change?
The reason that we have to start now is that if we don't start now, then we never start. So the issue of starting is also very important. The next question is about what about the skills laboratory practice should we assess not face-to-face? How do we learn? I mean, how do we know that they achieve the skills?
Yeah. Our tendency is to move away from the classic approach, which is to have skills training and then you have a skills test or an OSCE at the end of the year. We're moving away from that. We're thinking now much more on a programmatic way of assessing them. What we now do is that we have divided up the year group in smaller groups, and each of these smaller groups have a clinical skills teaching coach. And once the student has learned a particular clinical skill, the student can sign up with a teacher to get a feedback session on that particular clinical skill. So you have to perform that particular clinical skill in front of a skills teacher, and you will get feedback on it. And basically that's it. And we have skills teachers monitoring those group of students. So are they progressing? Are they showing sufficient progression in their clinical skills over time?
What about
so
during
we don't,
this? What about during the pandemic situation?
No, well, now everything is face-to-face contacts are canceled at the moment, you know.
Okay.
So not during the pandemic situation, but we don't rely anymore on big bang OSCEs.
Okay.
Right?
Yeah.
We do rely on many individual feedback moments.
All right. Dr. Fundi, would you like to comment on this about obtaining the skills ability?
Yeah, as I told in the presentation, it's very difficult to because teachers and the students are far away. So yeah, I think we need to find any innovative way because actually the skills for the undergrad medical student is major skills that should be able to do many everywhere. So the most difficult one is, I think, providing the mannequin or other complex tool for them, because they cannot have mannequins by themselves. But for example, for the auscultation, I think every student has their stethoscope, so some skills could be done by online system, but some of them are not. So for the region that is not so red in the pandemic situation, I think several innovations should be made. For example, if our government now limit the meeting up to 10 persons, so I think we can schedule students into the smaller group, because I think for some medical skills should still need face-to-face meeting. Maybe that's my opinion.
Okay, thank you. And there is also one question: is that feasible to have to collect the data from different points, Professor Cees? There is a question about feasibility.
Well, if we can do it, why can't you do it? If so many schools around the world are now changing towards a more programmatic assessment approach, why can't you do it? Naturally, this is the pandemic, yeah? So these are very exceptional circumstances. But it is all about changing towards a different culture. And changing towards a different culture is difficult, and even more difficult for you with your particular cultural approach. But I'm wondering why it couldn't work. If I talk about programmatic assessment, I always compare it to problem-based learning. If you want to move from a traditional system to a PBL approach, that's also a huge cultural change. And we've been involved with PBL and PBL changes over more than 40 years, right? And I've seen PBL implementations in many different countries in the world with many different cultures, with a lot of different resources. And PBL can be done in many different contexts. I've also seen it fail, you know, where there's no buy-in from the staff. I've seen it fail. So people have done away again with problem-based learning. And I think the same will be true for programmatic assessment. What I see currently is that particularly a lot of Western programs adopt problem-based learning. They implement it pretty quickly. I see implementations in North America, in Australia, undergraduate, postgraduate. And I understand that because it's probably more easy in a Western society. But like PBL, I would wonder what a programmatic assessment approach would look like in a Southeast Asian approach.
Yeah, I would like to talk to Dr. Diantha. You say that the teachers perhaps not ready for the programmatic assessment. Can you think of how to prepare the teachers?
I guess it, as Professor Cees said, it could take quite a while. But I agree with you, Dr. Mora, that we need to start. And I think my personal experience, my personal reflection, because we have started to implement reflective practice in some points of our students' education in one per semester, and with special arrangements for the reflective practice, I guess that helps students to reflect, and that also encourage teachers to provide a more reflective feedback, because they need to provide feedback to their reflection. And because we also have these modules that we can that for focusing not only on the knowledge but also on the professionalism, the other attributes, and that kind of domains, I think, require more different types of feedback compared to the knowledge feedback, I think. So it's about their professionalism, their self-awareness, their self-assessment. So I guess by putting it into the curriculum, by asking students to reflect, by putting that kind of module in our curriculum, by requiring teachers to provide feedback on the students' performance on that particular domains, we gradually begin to see more and more teachers capable of providing thorough feedback, reflective feedback, that kind of type of feedback. So I guess it needs to start. I think my personal experience, putting it into the curriculum and then make it something that needs to be done by everybody. But I guess having a community of practice where all the teachers can share their experience, their difficulties, their
I think there will be one question from Dr. Adrian to Professor Cees. Dr. Adrian, you can talk.
Can you hear me?
Yes.
Thank you, Dr. Mora. Can you hear me? Dr.
Yes.
Cees? Okay.
Yep.
Dr. Cees, thank you. I'd like to ask you, is it possible that we have like both systems? So we still have the national exams because we have 100 medical schools. We have 100 medical schools here in Indonesia, and so much heterogeneity. The schools in east part of Indonesia are the new ones. And of course, in Java, they have a long history of medical schools, like in Jakarta, Jogja, and Surabaya. So we still need like benchmarking like that for national exams, because otherwise we produce different quality of physicians for Indonesia, and that's not good.
Yes.
But I
Yeah.
like that we have to do the assessment with your new system. We have to learn about that. We like to have more data, of course, with the students, and that is a good philosophy, I think, because actually problem-based learning is for all medical schools in Indonesia is like a must, because in the standard of competencies for medical schools in Indonesia, there is a point that we should have the problem-based in our curriculum. Of course, we know that not all of the schools have the different types of PBL. Like in Jakarta, Jogja, they have almost type 4 PBL. If you remember the qualification of PBL.
Dr. Adrian, do you have a
Okay.
specific question? Do you have specific question?
Yes, I like to know if Dr. Cees agree that we still in Indonesia should have these Big Bang national exams or OSCE, but we have also to move to make some data. Is that clear, Professor Cees? Thank you.
It's clear and I understand it. And I would like to disentangle the discussion about the need for a national exam and the move towards programmatic assessment. Because tackling both will be immensely complex. So I think that you have a lot of medical schools, a lot of heterogeneity. So I understand your need to have a benchmark. And I understand your need to have a national exam. But the question is that enough? And if you want really to move towards competency-based medical education, you need to move further in terms of assessment. Then you can't assess everything with a multiple choice question. So actually, I think you should do both. So you have your national exam, but that doesn't mean you shouldn't look further into changing your assessment system.
Yes.
Yeah.
Yes.
Okay. Thank you, Dr. Adria. I have to move to another question. Is that okay?
Fine.
Thank you. So the next question is about how to do standard settings for programmatic assessment. Is there any standard setting for programmatic assessment, Prof. Cees?
Yeah. I have to take you into programmatic assessment a little bit, because for individual data points, we don't do a lot of standard setting. We simply provide either quantitative, relative information. So if you have a multiple choice test, you get quantitative information, your scores, as compared to your full cohort. So you'll know where you will be relatively to the rest of the cohort. We will also provide more detailed information like how you did on the blueprint of the test, so that you can see in which areas you do better and in which areas you need to improve. So that's the quantitative part of information that doesn't need standard setting. It provides relative information. The narrative information speaks for itself, right? It's not being standard set. Then, so this is for individual data points, but then if you have to then take a decision, a high-stake decision at the end of the year, that is being done in a committee, and the committee will use milestones of standards. So they will use narrative descriptions of the competencies that you need to master for a certain period of time in the curriculum, right? So if they make a decision, you should pass on to near year 2, then you should have mastered these kind of competencies, and that is a narrative description of those competencies. So the committees will use those narratives to make a decision. That's the kind of standard setting that they do. But then still, it is a committee decision. It's a professional judgment based on a narrative standard, based on a lot of data.
Yeah, I have seen like education for the primary care doctors in Australia, and they use many variations of different medical teachers, and they acknowledge each variations of the teachers and how to give feedback. And they say that it contributes to the development of the students, something like that.
Right. But what we don't do, and maybe I should say that out loud, we don't do expensive standard setting methods like ANGOFs and all that sort of stuff, right? Because we rather spend some time in increasing the feedback to the learners rather than do an expensive method for standard setting.
Yes. And the next question is, what is the role of peer assessment? How to do it well? Because students here tend to give higher score for their peers.
Yeah, first of all, you talk about probably a summative assessment, right? So then people start playing games.
Yep.
Yeah.
The
Secondly, you talk about
the 360 degree. Yeah.
Secondly, in the phrasing, in your words that you use scores, right? And the question is whether the peer assessment should be about scores.
Yeah.
If we do a peer assessment on professionalism, we want our students to give information, narrative information, not scores. So I want you to formulate a couple of things that you think that this person is really doing well and that this person might change. Right?
Yeah.
So you're probably right that the gaming that goes on is true for a very summative environment.
Yeah. Hello.
Hello. Yeah, I'm still there.
Okay. And this is a question from Dr. Fundi. How can we avoid to reduce the cheating during online assessment? For example, is that the person that is it the students or the other person who helped the students?
I don't know.
You know.
Question. I think it happened in the exam. I think then I think there are several things to do to control this, because before the exam they can sign some kinds of integrity pact, fakta integritas. Then I think we have we use it during SBMPTN or entry exam of the national for the higher education, that sometimes there are 5 numbers that are wrong and it pairs to the other test taker. So there are some procedures that I think we need also to learn about, the error similar analysis or paired index or some index that can presume that some of students do cheating in the exam. There are several ways of methods.
Yeah.
Yeah. So yeah, there are several methods to identify the cheating for the students, especially for the MPQ that we use it very dominant in our education.
Yeah, Professor, please, do we have comments?
We also, I know we have some experiments with proctored exams. where you have a camera of the laptop in front of you and the camera of the iPhone in the back of you. Boy. Yeah.
Okay. So this is a very good question. One of issue is narrative descriptions. How to prevent bias? Is that by gaining multiple narrative feedbacks for one student?
Yes. Again, we need to think from a programmatic assessment perspective. Individual feedback, an individual data point can be very subjective. And if I am your student, Mora, and you would give me feedback, then probably when I would ask Diantha to give me feedback, she would give me different feedback. From a measurement perspective, from a statistical perspective, this would be bias. It would be error.
Yeah.
But from a learning perspective, I might learn from your different perspectives on me, right?
Yeah.
So actually, if we talk about an individual data point, an individual feedback, I don't worry a lot about subjectivity. I think I'm kind of, I don't believe anymore that we can actually standardize assessors, that we can standardize to a certain single truth. I'm much more in favor of expressing the subjective nature of your feedback. And I think that from a learning perspective, that's not a bad thing. Then in the aggregation to a higher stake decision, then indeed bias is an important issue, right? So then you take measures that may reduce the bias from any decision making. And in my view, the high stake decision making is through consensus, through a group of experts agreeing on a particular decision. And you know, I've been part of such a committee in the past, and my only task was to ask nasty questions, right? Why this? Why that? And so there, the bias issue is really important. I don't think the bias issue is that important in individual data points. I actually, to some extent, embrace the subjective.
Okay. So I think that's all the questions in the chat room. Dr. Fundi, Dr. Diantha, would you like to add something? I think we are approaching the end of our webinar.
No, I think we've had an interesting discussion, and I think it's, well, we have to face the pandemic and we have to survive within the pandemic, and we try our best to modify everything we can. But I guess attention to the physical and psychological safety of everyone, I think it's quite important nowadays. But after the pandemic is over, I think we have to do something to adjust, to permanently adjust our assessment system. I think that's all, Dr. Mora.
Yeah.
Yeah, I think I agree. Yeah. I agree. I think we first have to survive this enormous crisis, because now we have a health crisis, but right after that we will have an economic crisis, which we all have to survive. But I certainly hope that the crisis will be used to rethink about issues, and hopefully also in the assessment business, so that we rethink about what we do and we think about alternative strategies. I hope that is hopefully the benefit of this crisis.
Yes. Thank you, Prof. Dr. Fundi, would you like to add something?
Okay, stay healthy, because we need to learn many things from this crisis, and hope to see you not only online, but by offline methods.
Yeah, thank you very much. So thank you very much for all the participants of this webinar. and Professor Cees van der Vleuten, which already commit time and attentions to these needs of Indonesia, and also Dr. Fundi and Dr. Diantha. And if everybody would like to join, we have a research in a programmatic assessment, and there's a participatory action research to follow up our concern how to start the programmatic assessment in Indonesia. You can click on the link. I think Dr. Nadia will provide the share screen about the link if you would like to join our participatory action research towards the programmatic assessment. Is there a link, Dr. Nadia? Hello, Dr. Nadia? Could you share the link of the participatory action research? And for Professor Cees van der Vleuten, thank you very much. And I hope to see you again soon, online or offline.
Hope so.
Yes.
Yes, hope so.
Stay
Thank you
well,
very
be
much.
healthy. Thank you very much.
You too. Stay healthy.
And,
Bye-bye.
Bye.
Yeah, best wishes from Faisal. Oke. Bapak Ibu, mungkin ini ada link dari Dr. Nadia. Apakah sudah di share screen ya? Mbak Titin atau Mbak Nadia?
Tadi sudah di-share, saya share ulang ya, Dr. Mora.
Ya.
Di chatroom, Dr. Nadia juga sudah menyampaikan pengumumannya. Ini Dr. Mora, silakan kalau secara singkat mau disampaikan.
Ya, Bapak Ibu, jadi ini ada sebuah penelitian bagaimana kita semua bisa mulai mewujudkan programmatic assessment di Indonesia. Tujuannya untuk menuju ke sumber daya manusia yang lebih unggul di abad 21. Jadi kita semua belum tahu bagaimana cara mewujudkan programmatic assessment. Kalau Bapak Ibu ingin mengikuti atau berpartisipasi, berpikir bersama bagaimana kita memulai programmatic assessment di Indonesia. Next slide, please. Ya, ini tujuannya. Kemudian next slide. Ya, ini ada formnya. Bentar, Mbak, yang sebelumnya. Mungkin formnya juga bisa dikirim melalui email nanti bersama dengan sertifikat yang Bapak Ibu terima. Kami akan senang hati apabila Bapak Ibu berkenan untuk mengikuti penelitian ini. Dan untuk Indonesia yang lebih baik. Terima kasih Bapak Ibu sekalian. Thank you very much.
Thank you.
Stay well, stay healthy and happy. Terima kasih IMERI yang telah memfasilitasi platform webinar ini. Dan selamat mengikuti webinar berikutnya minggu depan. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Terima kasih. Terima kasih Bapak Ibu.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih.
Waalaikumsalam warahmatullahi wabarakatuh.
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 Terima kasih Dr. Mora,
Assalamualaikum.
Claramita. Waalaikumsalam warahmatullahi wabarakatuh.
Terima kasih.
Waalaikumsalam.
Selamat.
Siang.